Okay, I'm gonna wash my hands. I got the MAR right here to confirm the doctor's orders for the patient today. We've got our patient is Anna Pawlowski. Her date of birth is 5/5/1957. She has orders here for 2 injections. We are going to be doing a B12 SubQ injection, and we're going to be doing a flu vaccine intramuscularly. Each injection is 0.5 milliliters, and we're going to go retrieve the meds, and we're going to be double check the 6 rights while we're in here. So we've got patient and we've got the med here. So for the first one, we've got patient Anna Pawlowski, date of birth 5/5/1957. She is ordered to have 0.5 milliliters of the flu vaccine intramuscularly, and at 14:58, and we're going to document once this is given. Then we're going to retrieve the B12 injection. She was ordered to have 500 micrograms. It was dispensed at 1 milligram per milliliter. I know that there's 1,000 micrograms in a milligram, so we only need half of that, so we need 500 milligrams or 500, and it'll equate to 0.5 milliliters of fluid from the vial. I'm checking both for expiration and particulates, and both look good. I'm going to gather my other supplies. I've got 2 1 ml syringes. For the first one that we'll be doing the intramuscular injection for the influenza, we'll be doing the 1 ml syringe with a 1-inch needle, 21 gauge, and this will be given at a 90 degree. And then for the other one, the 1 ml syringe, we're going to be doing a little smaller needle. It's a 5/8 inch 25 gauge that can be given at 90 or 45. So yeah, we've got our alcohol swabs. We've got gauze in case. I've got my gloves here, the sharps containers here. Let's go see the patient. Knock knock. Hello, my name is Nick. I'm going to be your student nurse today. Can you please tell me your name and date of birth? Okay, great. Anna Pawlowski, date of birth 5/5/57, and you have a allergy to penicillin, is that correct? Yes. Your reaction is hives, right? Okay, great. Let me check your bands to make sure that that matches up. Very good. So make sure the room's safe. There's no clutter, no spilled water, table's out of the way. The bed's locked in a good position. We're gonna pull the curtain shut, wash my hands, and so the reason I'm here today is we're going to be doing 2 injections for you. It shouldn't take too long. We're going to be doing your annual influenza vaccine, and that'll be done in your arm, and then we'll be doing the B12, which is your monthly. And do you remember where they gave you your B12 injection last time? In your abdomen? Okay, it was on your left side. We're going to do it on your right side. And what's your dominant hand? It's your right hand? Okay, we're going to be doing that injection on your left side then. Both of those might cause a little soreness at this point of injection. Have you ever had any adverse reactions to either of those injections? No? Okay, awesome. I'm going to prepare the medications here, and that's how it works. So I have the influenza vial, and I'm going to do my 6 R's again to make sure. We've got Anna Pawlowski, 5/5/57. She has orders here for a 0.5 milliliter intramuscular injection to be given at 14:58, and we're going to be documenting this as soon as it is given, and we're going to go ahead and fill that up. So we've got our alcohol swab. We're going to clean this. We're going to get the syringe. We're going to pull back the amount that we need. We're going to uncap our needle, and we're going to insert the needle in, inject the air in. We're going to invert, and we're going to draw out as much as we need here without getting any air bubbles. Okay, so we got that there. Okay, so I'm going to remove that and put that to the side. We'll recap our needle and put that over here. Now we have the B12. We're going to do the 6 R's again. We have patient Anna Pawlowski, date of birth 5/5/57. She's ordered to have a SubQ injection of B12, 500 micrograms. We have to do the calculation like I said before. It adds up to be 0.5 milliliters that we're going to put in the syringe. So I got my alcohol swab. We're going to clean the top of that real good. I'm going to remove that. I'm going to draw back 0.5 with the air, and we're going to stick it in, inject the air in. I'm going to invert it, and we're going to be withdrawing. Our 0.5. There we go. Okay. Put that to the side, and I'm going to recap the needle. Okay. We have our 2 injections prepared. I'm going to sit the patient up, and we're going to be doing the intramuscular deltoid injection first. So we just have to work with the shirt here. This is her arm. The patient is sat up. We're going to pull the sleeve up. We're going to locate the acromion process with 2 fingers down, and we've got this area right here. So I'm going to get the alcohol swab. I'm going to cleanse the area starting in the middle and working out. I'm going to let it dry, air dry. I'm not going to blow on it or anything. All right, and we're going to remove the needle cap. I'm going to do the Z-track technique and pull it to the side, 1 to 1.5 inches. I'm going to go 90 degrees in, and we're going to slowly inject it and hold it 5 to 10 seconds. And 5 to 10 seconds, we're going to pull the needle out and let go. And we're going to use our gauze here. We're going to recap the needle and put it in the sharps container. And we're going to get the gauze out and dab that if we need to, if it's bleeding, and stick a Band-Aid on it. Okay. How do you feel? Everything's okay. The injection site looks a little red, which is to be expected. We're going to be doing now we're going to be doing the SubQ. So we're going to lay you back down and expose the abdomen. I'm going to do the 6 R's one more time before we give this one. So I've hit the 6 R's 3 times for each med actually. So we're double safe. We've got the B12 injection for Anna Pawlowski, date of birth 5/5/1957. It's going to be SubQ, 0.5 milliliters. And we're going to be giving it in the abdomen at 14:58, and I'm going to document as soon as it's given. So this is now her abdomen. She's laying flat. We're going to go between the iliac crest and the costal margins, avoiding a 2-inch ring around the umbilicus. So that'll be right about here. We've got our alcohol swab again. We're going to clean our area. Okay. We're going to remove the needle, and we're going to pinch it up nice and good. We're going to stick it in, and we're going to inject the fluid, and we're going to pull it out and release and recap our needle, and we're going to put that in the sharps container, and we're going to tend to this if we need to, put some gauze, a little Band-Aid on it, and ask the patient how do they feel. Anything feel weird or different, any really bad pains, shooting pains? No? Do you want to stay laying flat, or would you like to sit up? Okay, so they want to stay laying flat, so we're going to cover them back up, get the bed if they need any water or a snack. We documented everything, and I'm washing my hands, and I don't have gloves that fit here, so I should have said before that I had gloves on. I don't think we actually needed them, but I don't have any gloves that fit on my hands, so I can't put them on here. So yeah, wash my hands, double check patient's okay. Room's safe, the bed's locked, it's in the lowest position. Call bell's up. I'm gonna open the curtain and make sure that they're good and they don't need anything else. And yeah, I will be submitting my IDing my 3 injection sites of IM and SubQ after this. I'm just waiting for my wife to get home so I can use her as my test dummy. I think that's everything. All right.